Hi, welcome to my channel. This nurse Chimax, also known as Queen Chimax. As usual, before we get to the business of the day, subscribe to this channel if you've not, like this video and share it. Today I'll be talking about essential tips for dialysis patients. Essential tips for patients with kidney failure. Yes, like I said earlier, the rate at which people's kidneys are failing is getting out of hand. The young and the old, no one is exempted. So this topic is really important. So if you know anybody that his or her kidney has failed, that is on dialysis, you really need to share this video to him or her to learn one or two things from this video. Okay, like I said, once someone's kidney has failed, there are, I my previous video I talked about importance of kidneys, so you need to go to that video in case you've not watched it or you don't know the functions of kidneys. So once you watch the video, so you'll be able to follow very well. So once someone's kidney is failed, the body needs to still carry on, so we need something to kind of replace the kidney. So once patient is on dialysis, the role of the kidney, the dialysis will help in doing some of the duties. Okay, so if you're a patient on dialysis, one of the essential tips I'm giving, the first one is to be optimistic. Yes, the mind has a lot of things to do with the whole body. Yes, do you know that even if physically, like physiologically, you're not sick and you start feeling sick, like start thinking it in your mind, do you know you're going to feel it? You're going to feel that you're sick. So psychology has a very important role to play in this case. Yes, you have to really be optimistic. Not when you are being told your kidney has failed, you just be like, oh god, this is the end of me, it's a death sentence. No, kidney failure is not a death sentence, or being on dialysis or any form of renal replacement is not a death sentence. So you have to be optimistic. The second point is to not miss your dialysis function or sections. Yes, patients are being scheduled for dialysis. Some people 3 times a week, some people 2 times a week, some once weekly, depending on their residual renal function. Yes, and according to their financial capabilities. Yes, too. So once they are being placed, your schedules, please don't miss them, because the kidneys are not there to remove toxins, like I said earlier in my previous video, to control the blood pressure, to remove fluid, and a whole lot of things. That's why you do not need to miss your dialysis sections, because if you miss them, the toxins, the fluid are still going to be in the body, causing what? More harm. When the fluid is even more so accumulated, it can go to the lungs and cause pulmonary edema. That's, you'll not be able to breathe very well, which is very life threatening. So you should not miss your dialysis sections. The next one is take your drugs. Yes, we all know that the kidneys, like I said in my previous video on roles and functions of kidney, the kidneys help to control, releases some hormones that helps to control the blood pressure. Okay, so once the kidney has failed, you are going to help, you are going to be taking drugs, some antihypertensives, so that the drugs will reduce and maintain, control the blood pressure. Okay, it's not just antihypertensives you take some blood building drugs like iron sucrose, recommend, that's erythropoietin. So you understand, in my previous video, I'll keep referring to this, my previous video on roles and functions of kidney. The kidney still takes part in blood formation. Yes, it takes part in red blood cell formation. So once the kidney has failed, you need to be taking drugs that will help to build the blood levels. So that's important. Another important thing, take your drugs. The next important point is dieting. Yes, the kidney removes urea, creatinine, fluid from the body. Now the kidney has failed. I know you're on dialysis, you do dialysis to remove these toxins and fluid, but you still need to monitor your diet. Still need to diet appropriately. How do you diet? You are going to eat food. You're going to reduce intake of food that are high in protein. Any food that has a lot of protein, you have to reduce them, because the more you take them, the more urea, you understand, is being formed in the blood, and the kidney is not there to take it, and it might even take time, some days, before you go for dialysis. So you need to reduce your protein intake, yes. And even some food that are high in potassium. And one thing I want to say is that you really need to read. If you or anybody is affected with kidney failure, the person really needs to be updated. The person really needs to be updated about foods that are high in some nutrients that to be avoided, reduced. Like, the patient needs to reduce intake of protein. Yes, have to reduce intake of protein. Have to reduce intake of food that are high in potassium, food that are high in sodium. Do you understand? So you really need to read, because if maybe you only know that food that is high in protein is maybe eggs and milk, and you're now going to eat something else that is still high in protein, you're contradicting the whole thing. So you really need to read to know food that are high in some nutrients. Like, if you have kidney failure, you really need to watch how you eat banana, because banana is high in potassium. If you have kidney failure, you need to be careful how you eat dark green vegetables. You know why? Because they are high in potassium. So when you eat all those things, it can really accumulate in the blood and cause havoc. So that's another thing about dieting. You need to diet properly. The next point is always come for checkup. Yes, we've have instances where a patient always take antihypertensives, but the blood pressure doesn't come down. Yes, so in this case, you need to really come and see a cardiologist. Do you understand? Yes, so you need to see a cardiologist to review your drugs, to add or reduce some drugs. So you need to see a cardiologist. There are instances where you need to see other specialties, like the nephrologist, the orthopedic surgeon. You understand? You need to keep coming for checkup, not just doing dialysis and going home. You need to come for checkup, to check everything, to know if everything is working. The next point is get involved in your care. Yes, you really need to get involved in your care. Like, okay, there are some patients that are like, whatever you are doing to them, you have to tell them about it. They know everything about them. There are some patients that if you ask them now, what is your urea level, they know. What is your creatinine level, they know. What is your PCV, they know. When next are you coming for dialysis, they know. When last did you do this one, they know. They know things about them. They know the next step about their health. Do you understand? And there are still other patients that, what is your PCV, they don't know. When last did you do this one, they don't know. You understand? They are just kind of carefree. You get? So it's good to really be involved in your care, because human beings are not computer. They can, maybe when your health care provider makes a mistake, you can be like, no, this is how it is, this is the right thing. Do you understand? You really need to be involved in your health. Not just being involved, you have to monitor your body, like master your body. This is how you feel when you get adequate dialysis. This is how you feel when you are due for dialysis, so that maybe when your schedule is like maybe next tomorrow, and you have one kind of feeling that is not normal, you know that this is time to come for dialysis. You really need to be involved. I don't know if you understand what I mean. You need to be involved in your care. Not when to do something, know when to, maybe if you're coming for dialysis, know when to do your PCV. You don't need to wait for the nurse to remind you. Please, patients, please, sir, ma, do your PCV. No, you don't need that. It will kind of waste your time or something. So you need to get involved. What are the things to do? This thing you are doing for me, what are the side effects? just get involved, read more about the condition, about everything. So that's this point. The next one is, do not argue with your health, with your nurses, with your lab scientists, with your doctors, everybody. You understand, when you are in the hospital, the health workers, do not argue with them because they are professionals. Okay, like you came for dialysis now, the nurse, the nephrology nurse is the one that is handling the dialysis. She's the one that is going to dialyze you. Okay, she'll now examine you with the help of your weight, previous weight and your current weight, and your physical presentation. You get what I mean? And now decide that I'm going to remove this liters from you. Do not argue. You can suggest, you can say, nurse, this is, I think this is what I want, because you give reason. But do not argue, because these nephrology nurses are professionals. They are, that is what they are trained for. You understand? Imagine a patient coming to argue with you. I've seen cases. I know what this thing I'm saying is so important. I've seen cases where, okay, I'm coming to carry out a dialysis on a patient, and I've examined this patient, and I've decided to take out 3 liters from this patient. But this patient say, no, nurse, 3 liters is too small. We are going to take 8 liters from. Yes, why would you say you want 8 liters? Do you know the effect of taking out 8 liters from your body within 4 hours? Do you know? So that is one of the things why you should not argue with your health workers, your healthcare providers, because they are professional. They, any decision they are making, they have reasons for that. So do not argue with your healthcare providers, your nurses, about your care. Once they tell you something, in case you are not clear, you can, when they ask you to do something and you are kind of confused, you can ask them question, why this? They will give you reason. But don't be like, no, I want this. Like I said, we have instances where a patient will be like, no, nurse, I want this 8 liters or 10 liters, because where I'm coming from, they used to remove 12 liters or more. You understand? These are some places where quacks, when I mean quacks, people that are not professional practice, people that just do carry out dialysis without knowing the effect, the aftermath effect. The right thing is, once you go to some establishment, they actually have different policies. The right thing is, do not remove more than 1 liter per hour. Yes, because if you remove 6 liters, 8 liters, the patient may not have any issue, but the aftermath effect is what we are considering. We, the professionals, we know the aftermath effect. So this, when you take a lot of liters, like, it do affect the heart. Yes, you can read some documentaries about it. Yes, it do affect the heart, but some of these patients don't know. Maybe because they are bloat, they have a lot of fluid on their body. They said, nurse, please take out 7 liters from me, just take 7 liters, because, and you are trying to explain to them, they don't want to listen, because they don't know. Do you understand? They don't know. So please do not argue with your nurses on the decision they are taking about you. You can ask them question if you are confused, and they will gladly explain everything for you. So the next one is, do not take non-medical advice. Like, okay, do not take medical advice from non-healthcare providers or non-healthcare workers. Yes, this one has really, we've really lost a lot of patients from this. You see cases where, okay, before I go, I think, you know, when once someone has kidney failure, I'm not going to lie, it's really demanding, like financially, your time, everything. Once someone has kidney failure, the person's life is not going to be the same. I'm not going to lie about it. Once someone has kidney failure, the person's life is not going to be the same, because your finances, financial involvement, your time, the food you are supposed to be eating, you are going to be, you are going to feel somehow. You might not be, some patient may not be able to take it. So they may hear some, maybe herbalist, you understand, saying something like, we all see it on social media, I heal kidney failure, I heal hepatitis B and C, I heal this one, I heal this one. These patients can be tempted. They will just say, how will I be coming for dialysis? My life has changed, you know, why I have a way of curing it. Yeah, some patients that don't know much about this, they'll be like, okay, let me go. And you see patients, once they go to and visit herbalists, they become worse. Some don't even survive it because the kidney is failed. The toxins that we are ingesting is not going out of the body. Do you understand? So once they go to herbalist or native doctor, whatever they call them, they give them concussions like herbal drugs. We call it abo in Nigeria. Once they take it, is there in the body, doesn't go out, so it causes a lot of havoc. Some patient, we've lost a lot of patients from this. Let me tell you something, I'm telling you this thing, kidney failure is not curable. Yes, it's not curable. The only way you can manage kidney failure is through some renal replacement therapies, which are dialysis. And dialysis are of two types: it's hemodialysis or peritoneal dialysis. Then the another point is kidney transplant. Any other thing aside this thing I mentioned is a lie. Kidney failure is not curable. Once someone has kidney failure, the person has to manage it for life. So you see people saying they cure kidney failure, they do. It's just market strategies. They even go as far as telling you that they've healed 5 people. They even some religious, I don't want to go into it, but kidney failure is not curable. It can only be managed through dialysis and kidney transplant. These are the only way that you can manage kidney failure. There is no other way of managing kidney failure. So do not go and listen to some non medical workers and they will tell you something that will come and add more havoc to what is being managed, please. So these are some essential points, tips I'm giving out to patients on dialysis, patients with kidney failure, with my experience as a nephrology nurse. Okay, so like I said, like this video if not, and subscribe to this channel if you've not. Then share this video, because this video is actually important. You really need to share it to your social media platform so that your well wishers or anybody that knows anybody that has kidney failure can listen. Thank you very much. I'm still Nurse Chimax, also known as Queen Chimax. Thanks for stopping by. Bye.